Welcome back. Prior to the coronavirus pandemic, nearly a third of our population was struggling with mental health disorders. Since March, this number has risen to 50%, meaning that every other adult in the United States is in active need of mental health help. Joining us today from Alleviant Health Centers of Denver is owner Chris Perez and psychiatric nurse practitioner Harmony Wright. I'm so glad you guys are here. It's probably an understatement to say that you're probably busy or will be soon after tomorrow. With the election and all the other stresses going on in the world, that seems to be part of the thing. So Chris, talk to us about really your new mental health clinic and how it can really help our community now in these uncertain times. The pandemic, of course, election, and anything else that might be going on.
Definitely. I'd like to start by telling you why we opened this clinic. And so we had a major life transition, a big family shift about 2 years ago, and noticed that our kids just were not doing well with that. And so we sought out some help for them, and in looking for that, it was very hard to find available, qualified providers. And once we did get an appointment, it was months out. And in that couple month time frame, one of our kids worsened to the point where her anxiety got so bad that they needed to go to the emergency room and the pediatrician multiple times. And as many of your viewers will know, it's incredibly difficult to watch a family member suffer like that and not be able to do anything. And so when I found Alleviant, I realized that it was exactly what Denver needed right now. So we're an integrative mental wellness center that's open now in Denver.
Well, I want to talk about, kind of just really get into some basic stuff here. You talk about healing the root cause of depression versus managing the symptoms, right? So many times that's what they just want to throw medication or something. Exactly. Explain the difference for us.
Yeah, definitely. Well, there's always going to be a need for medication in some of these conditions, right? But most of them just treat symptoms. What we want to do is address the root cause of what's driving that depression, that anxiety, that OCD, in some cases PTSD. So we want to look at, are you getting enough exercise? Is your nutrition well? We want to be able to offer these escalated therapies, TMS and ketamine, and sometimes reduce people's medication burden, or in some cases even get them off of medications completely.
Just providing a source of healing in any way, I think, is something that we're all searching for so many different things. Harmony, I'd love to talk to you next. And talking about the integrative holistic psychiatry, can you talk about what that really means and how the approach might be a little different?
Absolutely. Just kind of piggybacking off what Chris said is that traditionally you would come and say, this is what's going on, and we would say that's a symptom, and then we would say, well, these medications might be helpful. So a more holistic integrative model is saying that we're not just going to offer you medications, but we're also going to look at the mind, body, and spirit connection. Because, and then that also makes it a personalized approach, because that varies from person to person in helping them meet their mental health wellness goals.
And really how mental health sort of just involves all those categories of our lives, correct?
Absolutely.
I mean, as you deal with all of it. Can you talk about some of the services that you guys offer?
So we offer a full psychiatric evaluation to just go into depth about your history, what's going well, what do you want to be better, what types of things you've tried, and we do come, so we offer that. We offer medication management services. We also look at kind of what your goals are. Like, you know, we have our treatment recommendations, and then we also say what is it that you want to get better, and what things do you think would be helpful, and what things may not be so helpful. And then also we have escalating treatments, which means we can offer TMS and ketamine specifically for treatment-resistant depression, which is very important because, you know, depression is like the #1 most debilitating illness worldwide. And so there's lots of people suffering from these symptoms.
Yes, no, absolutely. And in fact, Chris, you mentioned anxiety earlier. A lot of people's anxiety right now is stemming from the fact that they can't leave their home or they don't want to leave their home. So how can people actually connect with you and to help, you know, connect with anyone that they might need help from the comfort of their own home?
Yeah, that's a great question. So we do offer full telehealth services. We have call center, and oftentimes you might get me on the phone for a while here. But yeah, and I really am concerned about people in the future as they're working from home. Where does that line between work and home end? And so I think we're going to see a big increase in anxiety as people are finding less and less balance in that work-life situation.
Yeah, the balance is definitely an issue for so many people right now, of all ages, whether it's work or school or anything else that might be going on. Now, how do people get a hold of you? How do they book an appointment? How do they, really get to see, or how soon can they actually see a health professional?
So we have appointments as early as next week, which is great, and we will continue to try and deliver availability within a week from being contacted. You can reach us at 720-400-7025 or alleviant.com/Denver.
Okay, so the resources are out there, and I think that's what's so important for everyone right now is whether you realize it or not, we might not even understand the repercussions of what we've been going through over the last 6 months until later, right? But you're seeing it. I don't really necessarily have this on the paper, but I wanted to ask you, is there an age range that you treat? Is it just for adults?
So we treat as young as 5 years old.
Okay.
Until the end of life, so 5 and older. And again, I think that one of our main goals is to make sure that people can get in right away.
Thank you guys so much. We appreciate that. Okay, heal the root cause of depression once and for all instead of just managing the symptoms. For years, you can request an appointment by visiting Alleviant.com or by calling 720-400-7025. They paid for today's segment, and we'll be right back.